I'm Dr. Sudhir, working at Unittas Hospital, Tambaram. Today we are going to talk about total hip replacement. It is a surgery wherein which we replace the surfaces of the hip joint, consists of cup as well as femur prosthesis. When only the femur prosthesis is replaced, it is called hemiarthroplasty. When both the head as well as cup is replaced, it is called total hip replacement. Total hip replacement is of two types. One is cemented and the other one is uncemented. Generally, cemented is done in older people when the bones are weak. Uncemented is done for younger people. Surgery in which is demonstrated in a small model. You'll be able to see that cup is replaced here. The bone is resurfaced with this cup, and the cup is attached with either cement or uncemented. If you see the femur bone, the thigh bone, wherein which we take a cut and then prepare the parts and insert this implant into this along with the head and then replace. The whole thing is made out of artificial now. Uncemented means where there is no cement. Cemented means there's cement involved in fixing the processes onto the bones. Thank you.